Good morning, ladies and gentlemen. I'm Gaylene Miller. I'm the State Director for AARP here in West Virginia, and I'm delighted to welcome you to the latest stop of the Protect Patients First national tour. This is a national coalition that includes several leading organizations that are advocating for better health care in the country. The groups include AARP, the American Cancer Society, the Cancer Action Network, the American Diabetes Association, the American Heart Association, the American Hospital Association, the American Medical Association, the Federation of American Hospitals, the March of Dimes, and the American Nurses Association. We're all joined together to highlight concerns that all West Virginians should have about the healthcare reforms that are being considered in Congress, including the U.S. Senate proposals. Here today, collectively, on behalf of our 1.8 million West Virginians, we're going to urge our lawmakers to protect patients first and address the shortcomings in these four main areas: affordability of insurance, access to essential care, protections for those on Medicaid, and protections for those with employer-sponsored health insurance. No one is immune. Joining us today are West Virginians who are here to share their personal stories about how the proposed health care changes in Washington would have a devastating impact, both financially and on their health, the health of their families as well, here in the Mountain State. Our first speaker today is LORA Wilkerson. LORA is representing the American Cancer Society, the Cancer Action Network. LORA serves as the manager for Covenant House's food pantry here in Charleston. She, like all of those that work at Covenant House, deal with individuals and families in need. At 18 months old, Laura's granddaughter, Ellie, was diagnosed with cancer. As a result of Medicaid coverage, as well as other protections made available through the current healthcare law, Ellie never missed a treatment. LORA is an advocate for affordable and adequate healthcare coverage for cancer patients like Ellie and other West Virginians. Please welcome LORA Wilkerson.
Good morning. On behalf of the American Cancer Society's Cancer Action Network, I want to thank everyone for being here today. My name is LORA Wilkerson, and I am the proud grandmother of a little girl named Eleanor. We call her Ellie, and she is who I want to talk about today. Ellie is a cancer survivor, and here today because of the treatment that was provided under the ACA, Obamacare. Ellie was 18 months old when she was diagnosed with rhabdomyosarcoma. This is an exceptionally rare cancer with just a few hundred cases diagnosed each year. With the help of Ellie's doctors here in West Virginia and at Sloan Kettering in Manhattan, she went through chemotherapy and specific radiation treatments that saved her life. We know that the reason she is alive today is, one, the advances in cancer research, and two, having access to quality health care. How would Ellie's mom and dad afford these treatments without the expansion of Medicaid through the ACA? When Ellie was diagnosed, her mom had to quit work to take care of her full time, traveling to and from the hospital for treatments, tests, physician visits, then several times to New York for treatment there. Ellie's dad would work extra hours as a heavy equipment mechanic so he could be with her as much as possible as these treatments occurred. Even as much as he worked, there would be no way he could have paid for the co-insurance and the treatments that would have been covered under the bare bones insurance that we used to have. Ellie would have died. Ellie survived, but continues to have nerve damage in her hands and feet as side effects of the treatment she received. She continues with weekly physical, occupational, and speech therapy. Her fight is not over. Still, we would rather have her going through these therapies than not being here at all. Having access to comprehensive and affordable health insurance coverage is critically important to more than 11,000 West Virginians who are expected to be diagnosed with cancer this year, as well as the estimated 107,000 people in our state who are cancer survivors, just like Ellie. The current health care law expanded Medicaid eligibility to all people up to 138% of the federal poverty level. And West Virginia's decision to expand its Medicaid program even further resulted in nearly 180,000 additional West Virginians being covered. Since the current health care law was put in place in 2010, the rate of uninsured West Virginians has decreased from 14.6% to 6% over the first 5 years. For people like my little granddaughter, there is nothing more important than access to health care. I am not an expert or a trained volunteer. I'm just a grandmother who is speaking out for a 3-year-old girl who can't do it herself. I want Senator Capito and Senator Manchin to know that affordable and adequate health coverage is critical for Ellie, as well as all West Virginians. I urge Senator Capito and Senator Manchin to vote no on the current bill and work together with senators from both sides of the aisle to find a way to improve our health care system and protect kids like Ellie. I'm proud to live in West Virginia, proud to be an American. This is our time to fight for those who can't fight for themselves. This is our time to make a difference. Thank you.
Thank you, Laura, for sharing Ellie's story. Our next speakers are Tom and April McLean, and they're representing the American Stroke Association, and they're joined by Debbie Smith, representing the American Heart Association. Tom and April McLean are stroke ambassadors for the American Stroke Association and residents of Charleston, West Virginia. This year, April celebrates her 3rd anniversary as a stroke survivor, and both April and Tom are passionate about speaking about those who cannot speak for themselves due to the impact of stroke. Debbie Smith is a heart survivor who is also passionate about sharing her story, and she's a member of the American Heart Association's Charleston, West Virginia Metro Board. And she's been part of the American Heart Association's Go Red for Women campaign, helping empower women to overcome heart disease, the #1 killer of women in America. Please join me in welcoming Tom and April McLean and Debbie Smith to the podium.
Good morning. I'm Tom McLean, and this is my wife, April. As stroke ambassadors for the American Stroke Association, we believe in speaking out for those who cannot speak for themselves, as is often the case with survivors of stroke. April celebrates 3 years this past month as a survivor of stroke. But if the current healthcare climate stays the same, or if the current healthcare climate were to change, her survival would be considered a pre-existing condition, making it difficult to find adequate and affordable care for her and for really thousands of stroke survivors across the United States.
Good morning. I'm Debbie Smith, and as a heart survivor and a member of the American Heart Association Metro Board, I have made helping improve health of West Virginians a priority in my life. I know firsthand the impact of heart disease, and like the tens of thousands of Americans who are battling it would be labeled as having a pre-existing condition, according to the U.S. Senate's health proposal.
The American Heart Association and the American Stroke Association believe that historic gains achieved by the Affordable Care Act should not be jeopardized by any replacement plan and should incorporate the following principles to preserve and expand affordable, accessible, and adequate coverage to individuals with cardiovascular disease and survivors of stroke. Affordability should be improved, but not at the expense of adequacy of coverage. This includes reasonable premiums and cost sharing and limits on out-of-pocket expenses for individuals of less health, older, and low income.
Along with affordability, the American Heart Association and the American Stroke Association believe access to care must be maintained by preserving patient protections currently in place, including the prohibition of pre-existing conditions, exclusions, and annual and lifetime limits on it with insurance policies, recession, gender pricing, and excessive premium for older people, for older adults. Finally, adequate health benefits must be maintained. All plans should be required to cover a full range of needed health benefits with a comprehensive and a stable network of providers and plan features. Guaranteed access of preventive services without cost sharing should be preserved. Thank you.
Thank you, Tom and April and Debbie, for sharing your stories with us here today. And now to share another important perspective on the impact of the proposed healthcare changes being considered in Washington is Dr. RAHUL GUPTA. He is the president of the West Virginia State Medical Association and a practicing internist who also serves as West Virginia's state health officer and commissioner for the West Virginia Department of Health and Human Services Bureau for Public Health. Please welcome Dr. Gupta.
Good morning. So I've been a practicing physician for about 25 years, and when I go to HealthRight, as example, I've certainly seen the differences that have occurred in the last several years prior to the Affordable Care Act. The challenges that we undertook to make sure that our folks that are coming to charity clinics are able to get insurance, enroll them into insurance because of the expansion, and then be able to treat them. And then now, it seems like in a lot of ways when I see those people, especially the smaller volume of people who are uninsured, there's no doubt the data shows that there's a big difference in outcomes in every aspect of measure, whether you're insured or you're not. So the typical and important question here for us is we're all about affordability and accessibility, but one thing cannot happen is we can't remove the foundation of the house and expect the other stories to survive. So health insurance is like the basic foundation of that house. In order to build for treatments, for things like opioid crisis, we need to have that foundation, because guess what? The person who is addicted, and addiction is a chronic brain disease with relapses, not a choice matter. That person will probably in West Virginia have high blood pressure, may have obesity, diabetes. How do they get that care? And they're going to have to go to their physician, other providers. They may get admitted, and the costs are high. They also may need prescriptions, they may need follow-up, they may need hospitalization. Who can afford that? So that's one of the challenges we have. No doubt the cost is high. In fact, I will assert to you the cost of healthcare in our nation is too much, is too high. But there is a way to approach that. The easy way is to knock people off insurance and then lower the cost. The harder road, but the correct pathway is actually to find ways to reduce the cost. And there has been a tremendous amount of work over the last decade or so, whether it's coordination of care, getting people into patient-centered medical homes, ensuring that there's efficiencies prevention of hospital errors and other errors. There's a tremendous ways of cutting costs. We know how to cut costs. It's a matter of will. Talk about the expansion population. Just the substance use disorder diagnosis as one of the diagnoses alone. There's over 50,000 West Virginians at a cost of about $112 million in 2016. Where did that $112 million go if these people are not insured any longer? And we know as a fact that this cost and addiction is not going away anytime soon. So just from an expansion population, it's a problem. We know that there are a tremendous, again, amount of people who are dependent on this coverage. We also know that our state is amongst the highest in consequences of obesity and tobacco in the nation, in terms of disability, in terms of diabetes, high blood pressure, stroke, and you've heard Ellie's story, cancer. How do we address the most vulnerable in our community, in our society? So I think it's critical for us to take this seriously, very seriously, and at the same time ensure that not a single person who has insurance today gets in a position where they have to lose that insurance. I think it's a moral imperative on us as both healthcare providers as well as others that are here to ensure that that does not happen, because the data does not support that there will be good consequences to that type of an approach. Thank you.
Thank you, Dr. Gupta, for your leadership and for sharing your perspective with us today from the state providers community. It is critical that West Virginians let their senators know the devastating impact that any legislation that would strip health care away from millions of Americans would have and would drive up costs. We know that right now, proposals are being considered in Washington, D.C., and there's even some talk about backroom deals. This is not a good deal for West Virginia. You've heard the stories today of the impact it would have on West Virginians and their families. In addition to the outlines that have been outlined here this morning, things like removing the protections for people with pre-existing conditions or cutting Medicaid. In addition to those concerns, AARP has grave concerns about an age tax. Proposals would allow insurers to charge Americans 50 and older 5 times more for the exact same coverage that they're charging somebody under the age of 50. Just doesn't seem right. Under the current law, keep in mind, insurers are able to charge up to 3 times more. So older Americans are already paying more for their health insurance. The age tax gotta go. In closing, I think the one aspect that cannot be overlooked is the real economic impact that Medicaid has in our communities. In West Virginia alone, our state could lose more than $2.4 billion worth of business output, and it's estimated 13,100 jobs could be lost in the next decade. Again, not a good deal for West Virginia. So on behalf of all of the coalition partners represented here today, we urge senators who have come out against the bill to stay strong, and those who might be on the fence to just say no. The people of West Virginia and our entire country deserve a transparent, bipartisan effort to stabilize the insurance market, drive down premiums, and retain patient protections that are critical to everyone. These groups represented here today remain committed to encouraging long-term solutions for the Mountain State's healthcare needs. We urge Senators Capito and Manchin to lead an effort to return to the drawing board on healthcare reform. If our senators can demonstrate their ability to work together, perhaps they can set an example for the rest of Congress and find ways, meaningful ways, to improve our healthcare system. So I urge you to call Senators Capito and Manchin, toll-free, 844-259-9355. That's 844-259-9355. And thank you all for attending today's news conference. I want to give a special thanks to our hosts here at the CAMC Cancer Center for their hospitality, folks like Bev Farmer and Jeff Good and Dale Witt, Gail Pitchford. I also want to recognize our other partners that are here in the room today that did a lot of work to make this event happen. Juliana Frederick and Ryann Moore with the American Cancer Society, the Cancer Action Network, Kevin Pauley with the West Virginia Heart Association, Tony Dicchiacchio and Lori McComas-Chaffins from the West Virginia Nurses Association, Lisa Creel from the March of Dimes, and last but certainly not least, my colleagues at AARP, Rich Stonestreet, Tom Hunter, and Angela Vance. And finally, for the members of the media, all of our speakers will be available for one-on-one interviews following the conclusion of the conference. Again, thank you all for being here.